You've got still silos. So the county is really focused more on the hospital structure. Really not a lot of contact with the community physician. So we've been doing the testing almost isolated from the county, and which is not the way it should be happening. And I think with the other side of the equation is, you've got people that you're setting up for distribution. We've been doing testing, and also flu vaccines. We have a lot more population than people think that we have. And I partner with Dr. Myron Glick, who's in Jericho. So between our populations, we have about 30,000 lives. And if you really want to touch those lives, it just was a better plan to include those entities in these models, and they haven't. And I think the problem we have there is CARE dollars, which are federal dollars, were used in September to design a vaccine program and a delivery model. And the inner city docs were not included, especially inner city docs that look like the community. So I represent the Black and brown physicians that are in private practice in the inner city. And no, we were not part of that whole process. And what I worry about is, it's okay to have this vaccine and set up for the healthcare providers in the nursing home. And I think hospitals can do that well within their system, but they don't touch the lives in the community. And I think in terms of distributing it to the community, it's going to be very difficult. It's not, I admire Dandy and Rich to be able to do the Rich product model, but that's a whole different model. They distribute to grocery store, top supermarkets and Wegmans. But when you have to get it out of Wegmans, we're the Instacart. And I think we have more access to these communities. You're going to, in the U of K, 74% of people are okay with getting the shot. In the States, it's about 60%. And among the Latino and Black population, because they're not trustworthy of this vaccine, you could be down in the 30s. So it's going to be really important to take a different approach. I always say the eyes can only see what the mind knows. You're going to have to kind of engage that market in order to be able to give it access to the vaccines. And I don't think we're doing that really well. You got to really get to the grassroots and really get into the physicians that are carrying. There's a trust. So myself and Dr. Glick, we're actually going to be, when the shots were available, we were going to be on television taking the shot, because I'm not going to recommend something that I'm not willing to be the first on. And I think the studies, and by Thursday, we should have this thing go live with the Pfizer vaccine, and be able to vaccinate people. I think what we've seen right now is it is safe and efficacy. And I'm one of your biggest, I'm a big critique. I criticize things to make sure that they're right. And I think right now it's the best we have, and I think it can save lives in light of the worsening COVID cases and deaths that we're going to be seeing in the next couple of weeks. I think it's a grassroots approach. We know the population, and I think, the patients trust. And I think in the past, we didn't have enough physicians that look like the community involved in the process. I think we have a little more now, and as a result of that, there's that trust. We're going into the data, and we're not gonna listen. The community, the Black and brown, these are my sisters, my mothers, I'm not gonna do something. And I've been here for the last 30 years, so I'm not a newbie to the process. I would never in any way do something to hurt the community. And I think what I see happening is the people that should be in the front of the line are going to be moved to the back of the line. And I think that's not a good thing. So I think it's just the models where once they feel comfortable with it, we have a hard time giving the flu shot, and that's always been a difficult thing to do, but we've been able to give flu shots. We've given over 2,000 flu shots this year alone. So it's just a matter of how you sell it to the patient. They have to see the benefit and know that this is a little bit different in terms of how it was. Tuskegee and syphilis and things that happened in the past, yeah, you don't want history to repeat itself, but at the same time, you have community physicians that have dedicated their lives to this community. And I think we could be the best voices, that churches, to really kind of resonate with the patients. And I think that's going to be real important, because if you don't have that trust, they don't trust hospitals, they don't trust the health department, but they still trust their doctor. And I think that you need to use that as a vehicle in order to have the delivery of these vaccinations. And as you know, the Pfizer requires constitution. It's a lot of steps and using it within a certain amount of time. So you don't want to also loose doses that can really, make an impact in our communities. Right now, the 170,000 doses that the state's supposed to get, that's 86,000 people, because it's a two-shot process. So that's it. I mean, you're going to try to get your healthcare workers in the nursing home. But I think after that, there has to be, we have data. We have data. We know exactly who should be on the front of the line. And I think, everyone's been doing homework on that assumption, but you've got to be able to really get out there and know that data. And I think by using your primary care network, which is often not included and it's kind of sad, because you got a health department that really should be engaged in talking to like inner city practices that are seeing the massive amounts of these individuals, and there's a disconnect. There's always been a disconnect. And so I'm here to say that while I don't want to be loud about it, I will make noise if I don't find that that's appropriate. I find that this may be a one-time thing once we get the 2 shots and you get it out of your way, so we can go back to what everybody wants to go back to, what the new norm looks like. But I think you got to trust the providers, and I know there's a lot of fake news and a lot of information not to do this, but it gets to the point that as a medical provider, I am telling you this. I am regulated by healthcare. If I say the wrong things, the Office of Professional Misconduct can take my license and put me in jail. So why would I be saying these things if I didn't find that the vaccine is of something of importance to really help the community? So as doctors, we have an oath. We've done different. So it's not a money thing. It's the right thing to do within the patients that we manage. And I think you should talk to your doctor. And I think they'll be honest and tell you what you should do. But we, at this point, the medical establishment, 90% of them feel that the vaccine is the only way out at this point. The state gets involved in their processes, but they really have to move away from, the ivory towers and systems, and really go out in the streets and talk to people and really have an impact with systems that are making a lot of impact within our communities that could be used. I mean, people talk about in terms of the vaccine distribution, there's a lot of different things we can do. The university had some projects in terms of how do you get this vaccine out to the communities? Well, you got to speak more than one language. If our communities don't know what the county's saying a lot of times, maybe the sign language community does, but they don't speak any of the other languages. And that infiltration is going to be real important, because those are the communities that were hit the hardest. So that's one thing, but really developing models to partner. We do mobile. How do you partner to get those? We're doing COVID testing. Those are the perfect players to really start to distribute. So, urban family practice, Jericho, these are the practices that are touching the lives that should be in the front line, and we can really help with that process. All we're asking for is, talk to us sometimes. That's it. Just include us in the decision, but listen to what we see viable. We have food trucks that are out there. We can repurpose things that don't work, and we can get food out to people and give them vaccines. But so, let's use infrastructure that's already there that we can just repurpose for this particular purpose, because at the end of the day, it's doing the right thing. Because if we don't do this, we're going to lose more and more lives as we're losing every day. And that's sad for this country.